A 17-year-old boy comes to the physician because 3 days history of frequent and painful urination and urethral discharge. He has not had a scrotal pain or swelling. He has no history of similar symptoms. Is sexually active with one male partner who is of same age and use condom inconsistently. He is in junior year at the local high school, lives with his parents and his older sister. Vital signs are within normal limits. Genital or urinary examination shows yellow green urethral discharge. The testes were symmetrical without tenderness or masses. A diagnosis of gonococcal infection is made. The patient requests treatment. Says, please don't tell anyone, especially my parents. They don't know about my boyfriend. This, which of the following is appropriate in this response? Yes, so we can prescribe the antibiotic without the informing the parents, and we can recommend the partner to get tested as the gonococcal can spread. Okay. So let's go through the explanation. So what are the exceptions to this rule where we require an informed consent from the parents or guardians? Remember, in emergency care, any condition that in which treatment delay can cause serious impairment of death, we, for minors especially, the consent is applied. Sorry, a pediatric patient? Okay. In pediatric patient, if there is a treatment delay that can cause serious impairment or death, the consent is applied. In emancipated minors, like the minors who can live by themselves or they have shown the ability to make an informed decisions, like if the minor is anyone below the age of 18 years old. So if the minor is a parent or he's married or is in military or he or she is in military service or is financially independent from the parents and he's a high school graduate or homeless. So this all scenario you can request this adolescents or minor has request to we do not require any kind of informed consent from the parents. While specific health scenario, if the patient is even living with their parents or is not considered emancipated minor, in certain situation we can remember this via rock and roll. Rock is whenever patient have any kind of substance use or is seeking any kind of drug to stop or addiction therapy. That time we can give uh, medical care. While roll is basically for any kind of sexually transmitted diseases or any kind of pregnancy care or contraception. So whenever patient have any kind of pregnancy, contraception or STD, as in this patient, we can give specific medical treatment without informing, without taking a consent from the parents. Okay. You can see a patient has acute cervicitis. Sorry, this patient has in sexually transmitted infection from Neisseria gonorrhea or chlamydia. The minors below the age of 18 can be treated without parental consent for variety of conditions, including STD. An addition of appropriate medical care in this patient has a right to be confidential treatment. Her health information cannot be disclosed without patient's permission. Maintaining patient confidentiality can build a trusting relationship between minor and healthcare provider. This allows minors to seek and access the treatment for sensitive health concerns like pregnancy or STD without embarrassment. So remember, we have to maintain everything to have a trusting relationship between the patient and the doctor. So therefore, what we do is annual screening for chlamydia and gonorrhea is recommended to all sexually active women at the age less than 25, and the women who are 25 with the risk factor like multiple sex partner or inconsistent condom use. So this is a recommendation to screen every woman below the age of 25 for chlamydia and gonorrhea.
Thanks for watching. Please give a thumbs up and subscribe for more.